If you think modern medicine is strange, wait until you step into the world of ancient Greece, where treatments ranged from practical to utterly bizarre. Imagine yourself as a patient in the bustling city of Athens or the sacred healing temples of Asclepius. You're suffering from an ailment, and the physicians of the time, followers of Hippocrates, Galen, or even mystical healers offer remedies that will make your stomach churn. One such treatment involved the legendary unicorn's blood. The Greek physician Ctesias of Cnidus, who traveled to Persia in the 5th century BC, described a mysterious one-horned creature that many now believe was a rhinoceros. This exotic beast's blood was said to counteract poison, restore vital energy, and cleanse the body of harmful substances. Not only that, but its horn was ground into powder and mixed into potions, a belief that persisted into medieval times and influenced Chinese medicine. Though there is no proof that the Greeks themselves used rhinoceros blood, the idea of magical cures from rare animals fascinated them and helped fuel the unicorn myth. But the Greeks did not limit themselves to mythical creatures. They turned to something far more accessible: animal excrement. Hippocrates, the father of medicine himself, recommended dung from dogs, pigeons, and even elephants to heal wounds. Physicians mixed dried droppings with honey, believing the natural ammonia acted as a disinfectant. Galen later confirmed this practice, and patients desperate for a cure had little choice but to endure these unorthodox treatments. If excrement wasn't to your taste, perhaps a good dose of wine and honey would suffice. This ancient remedy, known as kykeon or oinos me meli, was a cure-all. Cold, stomachache, poisoning? The answer was simple: drink more wine. Hippocrates was convinced that wine aided digestion, disinfected wounds, and had restorative properties. Patients were given wine not only to heal their ailments but also to dull the pain of surgery, as anesthesia was practically non-existent. For those suffering from chronic conditions, a visit to the temple of Asclepius, the god of medicine, was often the best option. Patients slept among sacred snakes in hopes of divine intervention. But some doctors took things a step further, experimenting with small doses of snake venom to build immunity or treat conditions ranging from headaches to poisoning. It was a dangerous practice, but one that foreshadowed the use of venom in modern medicine. Toothaches were another common affliction, and ancient Greek physicians had an unsettling remedy: burned mice. The ashes of a roasted mouse were sprinkled onto decayed teeth to relieve pain. This method, though disturbing, hints at an early understanding of antiseptic properties in burned organic matter. And then there was cow urine, perhaps one of the most stomach-turning treatments of all. Physicians applied drops of cow urine to infected eyes, believing that its ammonia content helped fight bacteria. While this may sound horrifying, ammonia is indeed used in some modern cleaning products and medical applications. Despite their strange remedies, the Greeks made remarkable advancements in surgery. Skilled physicians performed complex operations using scalpels, drills, forceps, and catheters crafted from copper, iron, and bronze. They understood the importance of sterilization, using wine, vinegar, and honey to prevent infections. However, without proper anesthesia, surgery was a brutal experience. Patients drank wine to dull the pain, but for severe procedures like amputations, they were simply tied down and forced to endure. To manage pain, doctors experimented with pressure points. They discovered that applying pressure to arteries, the temples, or the spine could reduce sensation and even induce mild fainting. This rudimentary form of pain management foreshadowed modern techniques like acupressure and reflexology. Perhaps the most terrifying surgical procedure was trepanning, drilling a hole into the skull to relieve migraines, epilepsy, or even to release evil spirits. Astonishingly, evidence shows that many patients survive this procedure as their skulls display signs of healing. Battlefield injuries were common, and Greek physicians became experts at removing foreign objects from wounds. Arrows, spearheads, and other projectiles were carefully extracted using specialized tools like forceps and scalpels. After removal, wounds were treated with cauterization, searing them with hot iron or boiling oil to prevent infection. When bones were broken or dislocated, doctors relied on techniques described by Hippocrates. He pioneered methods for setting fractures and realigning joints, using devices like the Hippocratic bench or the heel in the axle, a technique for shoulder dislocations. Many of his principles still influence modern orthopedics. Cataract surgery was also practiced, though it was far from the delicate procedures we know today. Greek physicians used a technique called couching, where a needle was inserted into the eye to push the cloudy lens aside, restoring some vision. Though primitive, this method remained in use until the 18th century. Amputations, while rare, were sometimes necessary to prevent gangrene. Without proper anesthesia, patients suffered immensely, though physicians took great care in wound treatment and post-surgical care. Ancient Greek medicine was a fascinating mix of science, superstition, and trial and error. Some treatments were surprisingly effective, while others were outright horrifying. Yet, through their relentless pursuit of knowledge, Greek physicians laid the foundations for modern medicine. From Hippocrates, who championed medical ethics and observation-based diagnosis, to Galen, who conducted anatomical experiments. These pioneers shaped the way we understand health and healing today. One thing is certain, medicine has come a long way since the days of ancient Greece.